Hi everyone, my name is Elisabetta Mezzalira and today I'm going to talk about sex differences and psychosocial risk factors in elders having spine surgery. I do not have any conflict of interest and background. So in the United States alone, there are 49.2 million people aged 65 and over. Depression impacts 7% of the world's older population, and anxiety disorders affect 3.8% of the older population. The psychosocial conditions, including anxiety, depression, and catastrophizing, have been linked to the development of persistent pain as well as opioid use postoperatively, with women reporting a higher degree of negative affecting symptoms. However, sex differences and preoperative psychosocial risk factors and their effect on postoperative opioid use in older patients undergoing spine surgery have been not fully investigated yet. The methods, so this was a retrospective cohort study which enrolled 690 patients, which met the inclusion criteria of being older than 65 years old and being scheduled for spinal surgery at the Brigham and Women's Hospital in Boston, Massachusetts, between July 1, 2015 and March 15, 2017. Mixed effect models were used to test whether sex modified the association of preoperative anxiety or depression indicators with opioid consumption or pain severity in the first 3 days post-surgery. This is the table 1 of the results, which summarizes the characteristics of the population. We can see a nearly equal number of males and females with comparable age, BMI, and ASA status. It's interesting to notice that females were more likely than males to take opioid, anxiolytics, or antidepressant, or have a history of anxiety or depression preoperatively. This is the second table of the results, and we can see that mixed effect models reveal that sex modifies the association of preoperative anxiolytic use, history of anxiety, and antidepressant use with mean opioid consumption 0 to 24 hours post-elective spine surgery. Males with a history of anxiety consumed a mean of 18 MME more than males without any history of anxiety in the first day post-surgery, whereas females with a history of anxiety only consumed a mean of 5.2 MME more than females without an history of anxiety in the first 24 hours post-surgery. However, no evidence was detected of an interaction between sex and history of depression with respect to postoperative opioid consumption, nor between sex and any of the evaluated psychosocial factors with respect to postoperative pain scores. The conclusions of this work is that preoperative psychosocial factors may have a great impact on pain control after elective spine surgery in males than in females. This concludes my presentation, and I would like to thank the team I worked for the last 2 years, and particularly our PI, Dr. Lindaglio. Thank you for the attention, and have a good day.